Welcome, everyone. Thank you so much for joining us on this third Thursday. Today, like every third Thursday, we are going to be coming to you with some hard-hitting topics that I think will help to improve dialogue and support every clinician in their effort of continuing to provide a safe, well-supportive practice. I'm going to start with just, sharing a little bit about today's topic because there's been so much momentum across every social justice movement that I don't think that we've done as great a service to our Indigenous populations here in the United States. So, and just across the globe. So tonight we are going to be talking about Native Americans, or the Indigenous people who have been part of the fabric of, in this particular country, of the beginning from everything. We don't the serious psychological distress, or that there are higher numbers of depression in the Indigenous population. So I am joined by some amazing experts in the field who are going to be speaking with us about supporting the Indigenous population and doing amazing work. And so I want to definitely introduce you to them. But before we get started with the introductions, I just want to make a few comments about just a few things about coming. So first and foremost, thank you all for joining us and making time during your evening after work, after seeing clients, or before family time. And just want to also let you know that at the end of this discussion, there will be the Pilates and meditation session that you will have access to from the pad. Please look for the code that's going to be in the chat if you would like to stay after to participate. Just FYI, for those who are interested, ATABS is now offering a discount for 15% off of any human diversity courses. You can use the code TW15 by going to ATAB's site. And then also, if you have any questions about the resources that are being offered during this discussion, please take a look in the chat. They will be posted there and you will have access to it. And if for any reason you have folks who couldn't make this discussion, but you feel would really benefit, feel free to send them the link after the discussion. It will be available on YouTube. You can also check out TogetherWell on all of the various platforms. And without further ado, we are going to jump into our discussion. But I really want to make sure that people know after our discussion, if you feel like you need to decompress, please make use of the meditation at the end. We like to ensure that we go deep in our topics, and some of the topics can be really challenging to discuss and sometimes challenging to hear, but it's nonetheless more important that we do so. So without further ado, I'd like to introduce our panel speakers. Today, we are joined by Michele Haley, and she is the Suicide Prevention Project Coordinator at the Northwest Portland Area Indian Health Board, under the Tribal Health Reaching Out Involves Everyone, also known as the Thrive Project. I'm going to abbreviate the first part. The Northwest Portland Area Indian Health Board Project is serving 43 federally recognized tribes in Oregon. And the Thrive Project provides suicide prevention trainings, resources, and technical assistance to Oregon, Washington, and Idaho tribes as well. If I miss anything, I'm sure Michele will definitely point those things out for us and recap on all the important work that she's doing. Additionally, we are joined by Liz Carr, and Liz is the Senior Native Affairs Advisor. She is working and she has extensive knowledge managing and improving federal tribal relations, as well as doing dedicated analytic work and development and implementation of federal policy related to tribal governments. And I missed on Michele that she is part of the Dene tribe, and wanted to bring it back to Liz, who is part of the Ojibwe Chippewa tribe. I want to also thank Alicia for joining us as well. She is our third speaker. Alicia Powers is a member of the Tohono O'odham Nation who has also obtained her master's in social work from the University of Minnesota Twin Cities. She began her Native American community clinic in 2018 and has a background in crisis intervention and integrative behavioral health. So without further ado, let's welcome our speakers and jump into some topics. And let's first start with, how are you all doing currently amid this pandemic that seems to not want to let up?
Yeah, times are tough. You know, we have seen disproportionate impacts in tribal communities with COVID for a variety of reasons. You know, lack of healthcare, lack of sanitation facilities, lack of access to education and public health facilities as well. So we're, you know, from a policy perspective, you know, I continue to advocate on behalf of tribal communities to ensure that we're getting adequate resources out to our tribal communities. So it's been a tough time, but, you know, we've seen a lot of folks from allies really kind of have our back and stand up with us too. So in terms of empowerment and in terms of folks really understanding some of the real challenges that we have in Indian country, I think it's an unprecedented time in that regard as well. And so they're trying to take the positive from a really sad and negative situation, and that we're really shining some light on really the inadequacies of the federal government's response to COVID, particularly in Indian country.
I can imagine the work is just so momentous at this point with trying to get resources in appropriate places. And I'm also wanting to make sure that you are taking care of yourself in such a time, because if we don't have advocates who are doing this hard work, it can be really challenging to get people to kind of step in.
Absolutely.
And for Alicia and Lael, I'm also wondering, how are you guys doing during this time? It's quite a bit of work that is going into providing services, advocacy, et cetera, and it's a lot. So how are you guys hanging in there amidst COVID as well?
I can jump in. I think it's a mix of things. Trying to hang in there as best as I can, trying to balance work and working from home, but then also dealing with, you know, so many other things. So I don't know. It's definitely challenging, but I'm really happy. I get to be near my family somewhat in the same city and get to see them. So I'm really thankful for that. And I'm really thankful for my workplace and having us like a supportive work environment. That's really understanding of, like, you know, the challenges that our communities are facing right now, and just, you know, what we're kind of the stress we're going through. So yeah, it's up and down. It's a mix. But, yeah.
I imagine. Alicia, anything you'd like to add?
Yeah, just kind of echoing how everybody's been saying. I think, you know, I'm really grateful for just working within therapists. I feel like there's an added level of just talking about how we're doing all the time. I just got off of a 7-day break, which was really, really important for me to kind of prepare for the next couple months and what might be happening. I was asking everyone where they were, and I love to see the responses in the chat because I think it's really you know, powerful to all connect in ways that we aren't really doing like we used to. Just hearing everybody in different time zones right now just kind of makes me feel, you know, held and connected across, you know, networking that we don't often get to do nowadays. And then on a more personal level, I think, you know, we always have our reminders of working from home in the pandemic. You know, I have my little dog next to me sleeping on the heated blanket right now. In Minnesota, it's cold and it's dark, and so you know, it's kind of always odd. The whole time I was thinking, is she going to be barking or something, you know? But our work and home is so intermixed right now, and you know, it's really nice to be by her and have some comfort. And I'm really grateful for this opportunity to connect with folks across the country.
Likewise, and I think this is super helpful to kind of ground ourselves in thinking about, like, how are we? Because as we jump into the topic of, providing support, advocacy, and making sure that there are appropriate resources for, tribal folks, it's important to check in on ourselves and make sure that we are balanced as best as we can be. So with that, I'm curious if you can all speak a little bit to just your work, what you're doing. And I know, Liz, you started with talking about what you're doing and how you're on the front line and doing a lot of advocacy work. Can you also share with us your particular journey into the mental health field and how you became such an advocate?
Sure. So I actually represent the Stronghearts Native Helpline, and we are a culturally appropriate, and sorry, that's my cat saying hello.
Hello.
Back off. So we provide peer advocacy and resources and services to victims of intimate partner violence and sexual violence for Native Americans across the country. So that's, I do the advocacy piece on the legislative and policy perspective, but the true heroes are the people on the lines taking those calls when folks need services in our community. So I want to give a shout out to all of our advocates at Stronghearts. They're so fantastic. But my journey into this field was a little bit, it just happened actually. So I went to school to be a physician. And I decided that science wasn't necessarily my thing. I love science, but I didn't want to be a scientist. And so what I ended up doing was shifting to a master's of public health. And I ended up taking a course with a professor who was really focusing in on health disparities, racial and ethnic health disparities. And he really pushed me and advised me to go home and work for my tribe because I hadn't planned on doing that. And I did. And I saw kind of the challenges that our tribe was facing in terms of implementing programs from a federal level that were culturally appropriate and really responsive to the community needs. And so I decided to then go toward shaping and helping to shape policy so that things that are appropriated down from the federal government are more culturally responsive to the needs of the community. And so that's kind of where how I got to where I am and how I I love what I do. It's all about the people in terms of really designing programs and designing policies that are functional for the people where they are, whatever it is they're facing, and that the community, in terms of tribal community, is the best place for people to be able to go back home to get the services they need that are designed for and by people just like them. So that's how I ended up where I am. Not necessarily a mental health specialist, if you will, but helping to guide some of the federal policymakers in that way.
Well, I'm sure we all would agree that mental health specialist comes in many forms, and the work that you're doing is going beyond that. It's supporting mental health, physical health, and everything. And also creating programs that are specific to the needs of the tribal members versus like this one size fits all model that tends to be unfortunately shared by our federal government. Absolutely. So I definitely appreciate you highlighting that. It's an important fact that I think many clinicians don't necessarily think of, because it's like we're providing resources, but we want to be true to the needs of the population we're serving. So thank you for sharing your journey and how you ended up in doing this work. Lael, could you talk a little bit about your journey, your work, and what led you into doing what you do?
Yeah, well, I think I'm very new in my journey. So I just graduated from college in May.
Congrats.
Thank you. Thank you. It feels very recent and was, during the pandemic. So no celebrations, but yeah, I think kind of my journey started while I was in school. I went to school in New York, and I am Navajo. So my people are in like Arizona and New Mexico, so the Southwest. And I grew up in Portland, Oregon, and then moved to New York for college. And sort of my moving away from home and being, away, all those experiences of being in school, I was like searching for counselors and therapists and just could find no Native support anywhere on my campus or in the city. And that was just really, really difficult for me, and really disheartening, and made school really hard. So through college, I just decided that I wanted to go into mental health as a Native person, and just to get into that. So I interned at the health board after my junior year of school, and just loved it, and loved the environment, and loved my coworkers, and seeing other Native professionals working in public health and working in healthcare was really inspiring for me. So I came back and I started working in March, and it's just been really amazing to see, I think, very specific, culturally specific and culturally relevant programming that I really wished I had when I was growing up or when I was in school, growing up in a city, all those different pieces. So it's been really amazing, and just seeing the importance of having, tribal health organizations, urban Indian organizations when it comes to mental health has just been really important for me. So that's my journey a bit.
Amazing. Thank you so much for sharing. And I think it is those experiences of not having a particular support or being able to have yourself reflected in an environment that leads to the development and access that we're seeing. Because without you, there would be the continuation of people not feeling like they can find other folks of the same background or same practices. So I think it's really important to highlight that this is how you ended up in the direction you've gone in, is lack of access. Awesome. And Alicia, could you speak to your journey?
Yeah, so I currently work as a therapist at the Native American Community Clinic in Minneapolis, and I saw some folks are here from Minneapolis. So for me, I think really mental health just started kind of as a human being growing up within my family, and just kind of every experience that I had, there was a lot of addiction, a lot of mental health issues. And so it was kind of always a part of my understanding of the world. And I went through college, and that was my first experience with going to counseling. Higher education provides access to so many folks to health insurance for the first time, and for me. And so having that, free, accessible counseling experience with someone that really was able to be present, and having a really good experience ramped up my passion for mental health. And then from there, I worked in student affairs for a little bit, and I just kept getting pulled. My favorite parts of student affairs were working with the mental health issues. I was doing event planning, but my favorite parts were kind of supporting students with mental health. And so I did some informational interviews with folks, with the MD degrees, the PsyD degrees, social work degrees, MFTs, and kind of chose social work as a path that kind of was broad. So kind of like you, Liz, had the micro and the macro options in the future. So I was like, I'm not sure if I want to be a counselor, so I want to keep my options open. So I chose my social work degree because of my interest in public policy as well, and just kind of the multi-levels that happen to folks before they sometimes even get to the counseling office. And so so I think for me, it just started on a personal level to understand my world. Mental health was a part of it, with my family and my community, and then moving up personally in my own life, how important it was for me and the changes that could be made. And as I've continued on, there's so many folks that I know where it starts, internally for us. And so that's kind of led me to the space I'm in now. And I think, going through your own journey of mental health really gives you a different way to walk the journey with others as they go through their own counseling. So that's how I ended up here as a therapist.
Well, and thank you for sharing that. And it's just amazing to have you three speaking about your experiences and the work that you're doing. And we really appreciate it. I think in the current climate, amidst everything that's going on in this current country, that there's been so many movements, so many hashtags, and I know the new phrase BIPOC or BIPOC, we don't see enough emphasis on the Indigenous people, and generally it's almost like Black and white issues in this country. So I'm wondering if we could shed light on some of the experiences of the Indigenous people here and some of the significant challenges that they've experienced. And Liz, you spoke to making sure that we have a curated program for tribal persons, because not everything is going to be helpful, and sometimes it can be harmful. So I'm wondering if you might be able to speak to what are some of the specific needs that you have seen needed for the populations you're serving.
Sure. I mean, I think you have to really focus in on historically kind of the genocidal impact of colonization on our people and what that means from an intergenerational trauma aspect, and how that flows through the generations to where we are today. In terms of the boarding schools that some of our ancestors attended, to the forced assimilation, to working within a colonial system today, right. Still, right? Like the government is a colonial system, yet we're still forced to work within those constraints because they are the ones who owe us, if you will, for the land that they stole. And so it's really a challenge when you're thinking about from a policy perspective, decolonizing work that is funded by the colonizer, if you will, right. And then making those systems fit within their constraints, but also be functional and purposeful and meaningful in the communities that they're meant to serve. And so there's this back and forth constant pulling and tugging on where we fit. And, you know, I think when we talk about Indigenous people, there's a spectrum of us. We're all so very different. We all have very diverse cultures, beliefs, understandings of the world around us. And we all kind of fall in this spectrum of assimilation too, right? Mm-hmm. We don't necessarily all fit in a box. And I think that's one of the most important things to remember when you're talking about Indigenous people, is that all of our experiences are very, very, very different. From the East Coast being contacted and colonized much earlier than those in the Great Plains, and much earlier than those in the Southwest, and the Southwest experiencing a different kind of colonization with the Spaniards. And so just thinking about all of those aspects, but also being able to really think about how we connect with other people of color in this country in terms of solidarity, in terms of liberation from the colonizer. And we all kind of face and feel that oppression of the colonizer. And so I think from our perspective, our work is really to be responsive to that intergenerational trauma. From a domestic violence perspective, obviously for us, violence isn't traditional. It never has been. It was basically put upon us by the colonizer as a tactic to control our peoples. And so it's really kind of breaking those chains of colonization and oppression, and thinking about it in that way, and being able to design programs that bring us back to our traditional ways, beliefs, and ways of life. And so it's complex, right? And it's right. Historical, and it's many, many different steps and many different directions that we need to focus on. But from our perspective in our work, it's really centering the sacredness of Indigenous women, and going from there.
I mean, as you mentioned, it is so complex, and it's almost like a Rubik's Cube. You can't come at it at just one particular angle. You have to try many different combinations. Right. And the challenge of navigating the finances with the colonizer, I can only imagine the kind of dance that has to be done to make it so that there's equity in some ways to get what you need. And the impact of that, right? So I can hear that it's super complex, but those complexities create symptoms. And I'm wondering, what symptoms are you all seeing that in some ways are being addressed? We know it's a Band-Aid for now until the complexity is fully addressed, but what are the challenges that you're addressing at this time that have made an impact?
You know, I think for us, it's really kind of breaking down some of those stigmas, right? Respecting who you are as a human being, bringing value back to being Indigenous. We've been devalued and dehumanized for so long. Raising the visibility of Indigenous people, right? Like, some people don't even know that we're real, right? We're still just a cartoon, or we're a brand label. And it's raising that awareness and feeling good about who you are as an Indigenous person is one of the big things that I've seen in the last couple of, and I'm relatively young, right? I've only been doing this work for 10 years. I would say in the past 10 years, I've seen more people be more proud to be Native than when I was growing up. And I think that's a really important step forward in terms of growing as a people and really healing from all those years of oppression, trauma, and genocide.
I appreciate you bringing up that point, because you can't have equity unless you're present. Like, you need to make sure that there are people at the table. And so that self-identification and appreciation for the culture, I think, is really important. I'm wondering if both Lael and Alicia, if you have thoughts as well.
Yeah, I can start. I think, of course, agreeing everything with what Liz said. It's just like this kind of tug of war, like balance, I think, working within the colonizer system and trying to work for Indigenous people and for our communities. But one thing I would add that we've seen with, young people that we're working with at the health board, and then even with my peers and, cousins and siblings, is like, I think the identity piece is really big. So either being removed from your tribal community through, forced removal or assimilation, or moving to cities, or, being mixed. There's so many different factors that kind of go into how people identify themselves and how they see themselves. And so I think a big piece of this is like affirming Native young people's identities, and kind of building in that like cultural pride and self-esteem. So like if it's doing, crafts, traditional crafts, or learning beading, or learning drumming or dancing, those different pieces that are super significant, but that have been taken away from us or denied from us for so long. I think that's a big piece that I'm seeing kind of my generation doing a lot of, and getting, being passionate about. And I think kind of tying into that is people speaking out more and just claiming more like two-spirit identities, and just being more aware of that within tribes, educating elders about that, all these pieces that colonization has like denied two-spirit people, to have their identities recognized or respected. And so seeing a lot of people sort of claiming that and demanding those identities to be respected is really amazing. So yeah, that's what I would add.
Amazing point. Thank you. No, go right ahead.
I was going to say, both of you just really spoke to this like tug of war, and that's colonization in and of itself, right? That you're never enough and you're too much. And, I really work on a micro level. I work one-on-one with folks, children, adults, elders. And I think, kind of what everybody spoke to is this piece of, I think for a lot of folks, like, we know how to heal ourselves. We've always known how to thrive. We've always known how to take care of our others. And really, it's just, intentional harm that's been done by others to put up barriers in there. And so I think, even, I think other folks have spoken to this, but even the therapeutic process is colonization, right? To have a DSM, to have, these pathologizing of experiences, and so I think, a really big piece of that is just naming what we know, right? And it's kind of this piece, and we'll talk about it probably more later, but this trauma that gets passed down is also passed down with this inherited resilience. And so I think, making space for wherever somebody is along their journey, if there's someone who really doesn't identify with their Native identity, and that's something that's harmful for them because of what's happened to them in their lives, or having someone that's seeking out, healing. I think one of the biggest things that time and time again comes up in my work at the Native American Community Clinic is just that I'm not always the right place to heal with someone. I'm not the right person to offer that. And also there's a lot of really incredible things that we've always been doing as people. So a lot of the work at my clinic, like everybody else has said, is just reconnecting people with things that we've always had and we've always known. And that's kind of something that is the biggest challenge and the biggest, privilege that we have. Eduardo Duran has a really incredible book written called Healing the Soul Wound. And I think it really captures this idea about what trauma therapy means and what that is. And it kind of speaks to the fact that, for folks who are Native, it's not, PTSD, right?
Mm-hmm.
That trauma it's this soul wound. And putting it in a way that's a little more spiritual, really kind of conceptualizes historical trauma, and then intergenerational trauma, to children.
Right.
How it's really a soul wound, and then to heal that soul wound is really speaking to the soul of the person, the community, the earth. And so a really good recommendation for therapists and folks working in mental health is that Healing the Soul Wound by Eduardo Duran, just because it speaks to the intergenerational trauma, and also the connectiveness and a lot of identity around, you are part of a community and a relative, and how that all of that healing at the same time creates, a good outcome. So.
Well, I appreciate that you speak to the healing, and if you are interested, for our viewers, if you're interested in getting the name of the book and the author, it will also be in the chat, so check it out. Also, if you have questions or comments or thoughts that you want to share, please do so in the chat. We do take our time to take a look at those and interweave them in as we can. But Alicia, as you talk about healing, I'm thinking about, we've also done a lot of talking about colonization and the impact of colonization on Native peoples. And I'm wondering if we can talk about what decolonization actually looks like, because sometimes it's a framework that I think is so ingrained that it's hard to imagine what the opposite would look like. And you've Alicia pointed out to the DSM and our therapeutic process, and you are trained in such a way that it becomes a default. So what would decolonization look like, and what would you envision the impact of that decolonization being on Native communities?
I can start if you want.
Sure.
Yeah, I'm really glad you brought that up, because I have a really specific example, kind of talking about folks who are two-spirit, or gender fluid, or many of the terms that fall under that category. Recently, I've been working with a patient, and that's kind of come up, right? Because we started our work, and this is kind of just a one person example. We started our work talking about panic attacks, and we kind of did work around recording panic attacks and when they happened, and we talked about that, we broke it down 25, 25, and then 50% other. 25% of the time, this person was having panic attacks because of their body. And it was a really big surprise to talk about that. So there was that and a couple other things. So then this person, when we decided, well, where do we want to start with working on what causes the panic and where the trigger is? And they chose to begin with the body. So this person presented for panic attacks as their mental health condition. And through exploring other things, we kind of determined that that they had gender dysphoric disorder. So that's in the DSM, right? And I have a lot of feels, even as I'm speaking about it right now, right? Because as someone who's queer myself, being queer used to be a DSM diagnosis, right? Being non-heterosexual in the DSM-3 was a mental health disorder, right? So in this particular example, I try to bring decolonization to my work and use it and understand that therapy is a tool that we have, right? And just like Native folks have always used what we've had that makes us feel better and is the way that we use it. Therapy is what's helpful for this person. They choose that, right? So when giving the diagnosis of gender dysphoric disorder to someone who's understanding what their gender identity is, it's incredibly important. I've had so many conversations about consultation, about how to bring this up. But this was the place that the person identified they wanted to do work in, right? So the way that I tried to do my best at decolonize, and I'm sure failed in many ways and be better in the future, is I just really named how much I hate that and how much I wish this wasn't a thing. This particular diagnosis had an entire class around it in my grad program, presented by someone who was trans, who worked for a trans organization. In the future, hopefully this disorder will be qualified as an endocrine disorder and be a physiological disorder and not a mental health disorder. Because the thing is that removing it with the DSM then causes folks to not have access to surgeries for solutions, right?
Right.
So while people might advocate to remove it, it actually harms the community more than helps it. So all of this I said to the patient that I was working with. They were very emotional, right? Because it's a very complex issue. When we talked through it, decolonizing for this human in this particular situation said, I hope that this can open a door for you to get top surgery, which is what they were hoping to do and had dreamt about. It sucks. You know, the biggest thing was figuring out how to work with the tools of the colonizer sucks.
Right.
And we can work with them to get what we need. That's usually how I try to describe it in mental health. Whenever I do a diagnostic for insurance purposes, whenever I talk treatment goals, I say you get to decide, this is your time. And also I try to name that we're working within a system that isn't the way that we've always had it. That's the way I do it on an individual level with that individual person. They did feel, you know, like it was kind of a personal failing or personal fault. And we talked about it. And they said this is the first step for them to get top surgery in the future. So that's that push and pull that we're always in. So that's just one example about kind of how that comes up.
I appreciate that. I mean, it's a strong example. And the importance that, I mean, most folks who know me know that I'm not a fan of the DSM or how insurance requires it. But and of course it's there, and it is very problematic, especially for that particular diagnosis. It's a pain. But I think that the way that you handled it was amazing. And it also gives us a bit of a look into what could happen if colonization were kind of removed, the idea of how there is flexibility. There are other ways of thinking. It's not necessarily problem focused. There are experiences that need to be thought about and felt and experienced and supported. So I appreciate that. And I'm wondering if Liz and Lael, if you could also speak to what your thoughts and just in using your imagination, what would a decolonized experience look like?
This is like a dream exercise, right? So, you know, we would talk about in some of our meetings, what would housing look like in a decolonized country, world, right? And we think back to the way we lived prior as a village, as a people who shared duties and shared responsibilities and looked after one another as a family. And so we've talked about that. And then we say, but what about rent? Who's going to pay the rent, right? Who's going to pay the water bill? Who's going to pay the electric bill? And so it's like that constant push and pull and tug. And I think that's my struggle as a person who advises on policy. Is like, but we didn't think about this. And it's like, when can we take this away and actually work to be healthy and functional the way we're supposed to as human beings, right? And not in a way that is shaped by capitalism, colonialism, and white supremacy, essentially, right? And so how do we break away from that? And that's my constant struggle, because in my mind, it's like, I see it. It's in my dream world. Like, I see the way things are supposed to be, but there's so many barriers to get there. And it's like slowly knocking down those barriers, one thing at a time, right? We have 2 Native women in Congress now, right?
Yay.
That's breaking down barriers, right? So they're waking people up. They're telling stories, and people are trying to understand kind of the way we think and the way we do things in Indian country. And slowly but surely we're getting there, but it's like, I want it now. Kind of thing. And so it's like that frustration. And so I think we do these exercises and then I walk away frustrated. But at the same time, at the same time, like, we're getting there, right? We're slowly breaking down those barriers, and we're gaining more allies as we speak, right? I think people that are listening on this call who maybe never engaged with a Native American person before are probably learning and hearing things that they've never thought about before, and that's a step in the right direction. And I think for me in a policy world, my motto is like, a baby step is better than no step at all. And that's kind of how I frame my work, even though I want to take like marathon steps, but that's how I deconstruct colonialism, if you will.
I think it's amazing. The baby steps, yes. And I think when we get to a point where we're no longer saying that, like, this person is a first and this is a barrier that we're breaking, and actually getting to a point where we're revisiting, no, that's not the right word, where we're embracing the differences, and not just differences in people, differences in thought, just difference, period. Because it's the variability, the variety, it's that experience of having difference that allows us to kind of grow as a society, as a species. I mean, I know Darwin, I have my issues with Darwin too, but we've known from years that species variation is important for it to thrive, and we've not been doing that in so many different fields. We've only been looking through one myopic lens. So I appreciate you speaking to that need to continue to break down these barriers, make these small steps, and make what's unfamiliar more familiar in order to bring about change. And Lael, I'm curious about your thoughts too, as someone who just recently graduated, going through a process of hearing a lot about a colonial process. So I'm curious, what in your mind would that also look like, a decolonized experience?
Yeah, well, I think, there's so many pieces. I think when I think about decolonization, I'm like, first get rid of the US and then like build up from there. Let's get our tribes back, and like, let's just kind of go and there's that dream, and you just think about this history and it's so painful. But I think within like suicide prevention, when I think of decolonization, it's within suicide prevention, there's so much focus is on the person and maybe their family, and just this small bubble of people, but looking at it as like access to housing and food and healthcare and all of these issues that, we can't just put suicide and mental health into one category, but it's like so connected. And even access to religion and cultural practices, like kind of just looking at mental health and suicide within this whole realm of things. And once we can get everyone like free housing and food on their table and healthcare, then I think that is how I see like decolonizing mental health, because we know all of those things connect and like stress us out and increase anxiety. And so by taking those away or just minimizing that, we can really start to decolonize there. And I think another piece that is interesting to think about, that I kind of think about, is how we can like kind of decrease our dependence on like capitalism. So how we can practice mutual aid with our communities and with our friends and neighbors, and like get things, through trading, and that we don't have to, go to the store and buy stuff, which is how we like originally lived as Native people, and how so much of the world has originally lived before capitalization and capitalism and colonialism and all of these things. So that's just something like I think about, and I think we can like practice and try to do, but it's such a huge step. But I think there's those little steps that we can like start to do in our communities, at least.
Yeah, I'm hoping that we do go in that direction, because we are as a capitalist society, we consume so much, and there is so much waste and so many things that are left over that are, just random things that are left over. And in some ways, the capitalist belief was kind of based on the sharing of goods and trades and things like that. But that's not what we're doing today. We're totally far off of that. If that were true, the banks would have failed, but we're not going to go into that. So just in thinking about, kind of going back to a time where things were I don't like to say simpler, but things were more accessible and people were more connected, it makes me wonder about kind of mental health and the direction that we're going and trying to promote and trying to support. But I'm wondering if there is a stigma around mental health and accessing care or support in the Native community. And I'm wondering, is that seen, or is everybody open? And if so, do you also notice a hesitancy to receive support for any type of mental health support, whether it be for DV or any other areas, and what would that look like?
Yeah, I can speak to the DV piece of it. It depends on the community first and foremost. I think recognizing that every community is different, and the way folks view domestic violence is different. There is a stigma, but there's also barriers in terms of the communities being so small that if you do reach out for help, that person who's helping you might know or be related to your abuser, right? So there's many different issues that play into the DV aspect of it and the stigma of getting help or removing yourself from a situation or leaving the situation. But from the mental health aspect, I think, I'm just going to say that, again, we're just such a diverse group of people that it differs. And I think that a lot of times when you think back to what you're calling a simpler time or prior to contact colonization, we really relied on our family and the community as a support network and a support team. And I think we've really gotten away from that as a result of capitalism, colonization, and amongst other things. But I think that just thinking about that and, growing up, I suffered from mental health conditions and there was a stigma. Now that my nieces are growing up, there's not so much of one. So we're kind of like shifting, right, as a community. But it's different in every community. I can only speak to my own experience, obviously.
Thank you for sharing. And I'm wondering if, Alicia, you can also speak to your perception on stigma and the changes that may have occurred.
Yeah, definitely. Yeah, I think, it's really interesting. And I kind of, so before I worked in individual outpatient counseling for individuals, groups, and families, I did brief interventions in the medical clinic. So that paused when COVID-19 started. The less people in the medical rooms, the better. And so, so I was an interventionist, a brief interventionist doing, brief visits with folks as part of their medical visit. And so I think this was a really special place. I had a background in integrative behavioral health. So kind of thinking of the medical team, often in our medical world, everything is siloed.
Right.
And it's really hard to have kind of comprehensive care. And what's great about working at a community clinic is we have, our medical care, our behavioral health care, we have our dental care, we just built in neuropsych testing, and we have an intensive outpatient program and housing. So we all built that in within the past 2 years that I've worked there, which is incredible. And also kind of provides that really continuity of care. So working in those brief medical visits, what was really powerful is talking through people's space, right? Because you aren't making it you're there for a medical reason. And what a lot of Native folks, know about our lives and ourselves kind of relates back to this medicine wheel, right? So we have multiple elements of our health that are all connected. So someone comes in with a cold that they got 2 weeks ago when their partner passed away, right? And so the medical doctors are constantly seeing these conditions that are really huge in our society, things like diabetes, and then I would meet with someone and do some health coaching and realize that, well, when they get depressed, they eat 10 chocolate bars. Right. So everything is so connected. And but there is quite a bit of stigma. And I always think it's rightfully so. The health history of treatment for Native American folks in this country is horribly disgusting. What happened to folks within a medical context was a lot of harm a lot of the time. And so I think, you see a lot of that stigma that's, appropriate, I think, right? Inherited appropriately. However, it can also, over time, lead to lack of getting things checked out and things that can preventative care. So working in the medical settings, stating, kind of this special place where you're not in a counseling room, you're in a medical office, having a brief intervention, really provided a lot of space to discuss what we in counseling talk through as motivational interviewing. What are the pros and cons of going to counseling? What are the pros and cons of not going to counseling? And we just keep meeting every time you come in for a doctor's visit, right? What is the safest way for you to engage as a person? And for a lot of folks, I think that stigma is really appropriate. You know, when you've heard about, like Lael was saying, there just isn't someone that can understand you, right? Or you get your healing at sweat or at ceremony, right? And so that stigma, I think it's really important to break down the different reasons why. If it's something that's preventing someone from living their best life, then maybe. But again, time and time again, I always say, you know, mental health therapy isn't for everyone. And that's not always the way they're supposed to heal. And so I think teasing out why and where and how healing can happen is a really big, important part to teasing out the stigma.
Yeah,
that's at least.
I wanted to add, there's a really important piece that I think that we're not really mentioning, and that's distrust of the system, right?
Yes.
You know, the medical field, the behavioral health field, the educational system has failed our people time and time again, intentionally, many of those times. So I think it's one of those things that we still have to work in terms of, you know, thankfully there are Native clinics across the country who are rebuilding that trust from a Native perspective in a Native way. So I think that's one of the biggest things in terms of stigma. It's not necessarily stigma, I'm less than because I need mental health therapy, but it's stigma of the provider itself.
Right.
I don't trust those people. Why would I go there? I think that's an important thing to mention.
I 100% agree. History with Indigenous persons, just people of color in general, I think in relation to that, one of the big factors in relation to physical health, mental health from a colonialized perspective has been categorization or understanding groups or group process, and that has done such significant harm, and it leads to all sorts of has led to all sorts of inappropriate testing, and to some degree still happening in some places, and so there is a distrust, there is, and it's a valid fear. It's not PTSD. It is a healthy, rational paranoia of things that have happened. And I think that is something that our clinicians, our, you know, folks in office need to hear more often if they're serious about providing resources and being a support, that they have to understand that you aren't trusted. And that's just it. So in thinking about that, like, if you rush to be like, hey, I'm an ally, not to expect to be met with, yay, you might get a side eye, and that's okay. So but we're thinking about stigma, we're thinking about that lack of trust. And as we're thinking about it, we know the impact of not having access and the lack of resources has led to some very dire circumstances for many people in Indigenous communities. The one thing that I feel like we hear more about when it comes to Indigenous populations are the suicide rates, and how high, and astronomically high in many cases they are. And I'm wondering what trends that you three have noticed in the organizations that you've worked for or worked within. Are we seeing just changes to the numbers? Are we seeing that there are particular risk factors? Are we seeing that there are protective factors that should be in play? So just wondering what your thoughts. And Lael, I'm going to start with you on this one, and then I'll have Alicia and then Liz, if you can chime in after.
Sure.
Yeah, so I can kind of talk to the tribes that we work with. So the Northwest Portland Indian Health Board works with the tribes in Oregon, Washington, and Idaho. And there is a significantly higher suicide rate for tribal members in the region. And I think that's just from so many factors, from, you know, everything we've been talking about. And it's been interesting because during my time in the job and during COVID, working with mental health clinics or with providers in the different tribes, and seeing not necessarily, you know, like rises in suicides, but rises in crisis situations, or needing to work with youth one-on-one more to kind of help them in different situations has been rising. And I think that's like kind of just really showing the stress everyone's under from COVID, but specifically like showing the stress of isolation and feeling alone, which is I think one thing specifically within Indigenous youth suicide is that feeling of being alone, not feeling like you're being supported by your community, but then also by the greater society or culture. So I think those are big contributing factors. Obviously, not having access to Native American counselors or even counselors. There's just a huge, disparity with having mental health counselors on tribes and on reservations. But I think at the same time, there's a lot of really amazing programs that are happening within our tribes. So we do this, there's this one curriculum called Healing of the Canoe, which is a suicide prevention program with the tribes that traditionally do like canoe journey here in the Pacific Northwest. And so there's a lot of amazing ways that the tribes are working to build up connection to culture and really emphasize that resilience. So I think Alicia was saying this earlier, like we have inherited trauma, but also we have just as much resilience that is with us, that we carry from our ancestors and from our community. And so really emphasizing that and building on that. A lot of the projects in suicide prevention include doing things that are like, traditions and culturally significant. So learning about canoes or the canoe journey, all of these different pieces. So I think the statistics are always there and they're very daunting, but I like to try to focus on what's like happening and what are the tribes doing to really like counter this and focus on this and really uplift youth. So
Awesome. And Alicia, your thoughts?
Yeah, so I really liked how Lael kind of talked about a couple of different programs. I really feel like, the rates of suicide are the highest in the Native American population. And, I think a really big important thing that we like to talk about, at least in my clinic, is kind of the opposite of suicide is social connection. The same with substance use, right? And I think a really big part that's also kind of a trend that's been on the rise within the Indigenous communities is really opioid use. And there's kind of a large piece with death, right, that comes with use, kind of teasing out intentional death versus unintentional death, right, or overdose. And at our clinic, time and time again, kind of this is coming up, and the risks that come, with opioid use, and also just that, as when fentanyl came into kind of the picture, how that really just drastically changed use. And so at our clinic, we really do try to take a harm reduction approach to everything, particularly with suicide and substance use. It's really, time and time again, I've seen it as the opposite is social connection and identity, right? And these practices are things at our clinic that we're doing. There's so many times we have 2 spiritual care elders that work at our clinic, elders and residents. And they are just incredible. They are there for staff. They're there for our patients, the community. And since COVID has started, there's been such a high crisis rate and spread of COVID and, differences on reservations and in communities. And our elders have just been so incredible. They, offer traditional medicines. They offer access for, how to get to sweat. What do you do for your first sweat? What is smudge? How do you use the traditional medicines? What are different tinctures and teas that you can use to help things? So many different ways of healing. One of our elders, she does a ceremony around psychiatric medications. And it came from her own experience, really, where she's like, this is a medicine. This is something that is traditional. And when, different folks have different understandings of how we offer and thank the plants, right, for what they do for us. And so even having talks through things like maybe you need to do ceremony around your psychiatric medications. Spiritual care has been, it's an odd term, every time I say it, it feels a little weird, spiritual care. But it's really one of the most protective factors and effective factors I've seen at my clinic. Connection to those things that heal that soul piece of things. And then the other part of it is just we've been putting on a lot of different workshops, and we've been mailing out folks things. So we've been mailing out folks beading materials, and then doing an intro to beading class, doing ribbon skirts. We got a grant to do a whole bunch of sewing machines. We've been mailing out, different elixirs, elderberry elixir, fireside tonic. We've been hosting all these things to, and a really important point of this is to empower communities. In my particular clinic, I don't know the statistic off the top of my head, but a lot of our patients are on government insurance or underinsured or uninsured. And our clinic treats everyone first and then figures out the finances later, which is an incredible thing. And so for our community in particular, there's kind of this piece that has been removed from them of like learned helplessness, right? Like they've been in so many systems. It might be the CPS system. It might be the juvenile justice system. It might be probation. And there's so many people telling them what to do and how to do things. And so just giving folks the tools to heal themselves with traditional medicines, with ceremony, I think is a really important protective factor for suicide, because it revitalizes saying that you have, the choice of your life and it's your journey. And you're not in these systems that you're constantly a peg in a wheel, that we do. So, yeah.
Awesome. Thank you.
Yeah, and I think from my perspective, back when I was a federal employee and worked for the Department of Health and Human Services, I think a lot of what we focused on was removing the hopelessness from our Native youth and the communities that they're from. And how do we do that, right? And how do we provide programming and situations where they are able to, regain hope and see that their value. And I think we did a little bit of that, and I think we need to do a lot more of that. And I think that the protective factors of, as Alicia mentioned, is the culture, is the fact that we still have those things that the colonizer couldn't take away, right? And I think that's really important to remember in terms of using the sacred medicines. Like we kept that alive. Our ancestors kept that alive, and we're still here because of that. And I think that's one of the things that we sometimes forget as we work through society today. We forget where we come from and what's still there to serve us, that our ancestors fought for, right? And they survived for us to be here and to prosper and to continue this journey as people. And I think it's really important to remember that as a part of a protective factor.
I think it's amazing that you bring that up. And I'm going to deviate from our line of questioning just slightly, because I'm curious about how you all are thinking about the term colonizer, and how I may be thinking totally differently. And for our viewership, I think it's also helpful to inform them. And I know there could be a very, I feel like I'm using this word a lot, myopic view of who the colonizer looks like. But in some ways, I know that my training is very colonial based. And so there are ways that I have been a colonizer. And so I'm wondering if you can speak to what, not necessarily what a colonizer looks like, but more to what fits the bill as a colonizer. Maybe it's a mode of thinking, maybe it's a series of actions, maybe it is a person, but to speak to that so we have a little bit of clarity.
Gosh, that is such a complex, deep dive question. I think about that all the time. I mean, there are days of the week, there are moments of the day that I'm a colonizer, right? I do things that are, that my ancestors would have never dreamed that I'd done, in both good ways and bad ways, right? And both native, identifying and colonizing identifying. So I think it's really hard for me. It's really, really hard to define what that means. But for me, the ultimate overarching definition of a colonizer would be, capitalistic, white supremacist, misogynistic, just that maintaining that white man privilege, power structure and dynamic over the rest of humanity. And that's, and I have privilege. I'm going to recognize that I have privilege as an educated mixed woman, right? And we all have some sort of privilege. And I think that there's just this hierarchy of privilege. And I think we can all be colonizers at one point or another. And I think it's really hard to define what that means and what that looks like and who that might be. But from my perspective, it's really those folks who want to keep oppressing the underprivileged, if you will.
Yeah, I would also add that I think that's a great, you did a great job, Liz. I was like, oh my gosh, I don't know how to answer this. So you did a good job getting that. And I think one thing I would add is looking at like people who are settlers on the land. So like white settlers who are descendants of, early colonizers who were slaveholders and, actively stole land. So I think there's a lot of like white generational wealth within this country. And so that's a big piece that I look to as well for people who have just made their life in America from stealing land and from owning slaves. So that's another piece I would add.
Thank you. Alicia, any thoughts?
Yeah, such a good question. Such a deep question. I think it's really interesting being, my first answer in my head was Donald Trump. But outside of that, I was just thinking kind of more thoroughly, and this country is in such a complex political place, such a challenging place. I still feel like I'm holding my breath with everything, and I've been holding it for years, maybe my whole life. But I think colonization is such a complex issue, and time again, we're a Native American community clinic, but by no means do we say you have to be Native to come here, or you have to prove you're Native, or you have to have blood quantum, right? Because all of those are different levels of colonization within them. And that being said, our elders time and time again at our job, are such important people to consult with that, really time and time again just speak to that we're all relatives, right? Mm-hmm. We all come from somewhere. We're all from the globe. And even when I'm like, but not that person, or they don't belong here, or like, I don't even know what to do with this person anymore, right? Our elders just keep speaking those messages, right? And that's why they're elders. Mm-hmm. And I'm so I think there's this piece of colonizer that is othering sometimes, right? And when we think about our country and we think about who we are and the pieces of ourselves and the pieces of our country and our nation and the world, we're all relatives. And time again, our elders say that. That doesn't remove, historical trauma. That doesn't remove microaggressions or aggressions or any of that. But I do think there's an important message in there about what someone looks like, how someone acts, right, within our own communities. We have folks that have different levels of privilege, right? Folks with blonde hair and blue eyes that grew up on a reservation. It doesn't, I think understanding identity in us versus them, or we are or we aren't, it's so colonial. And so I think, while many times I struggle with the message of we're all relatives, it pisses me off. And I just want to say no. I think there's a really important truth to it. And I think it's important to name systems and issues and injustices. And like you said, name the allies that Liz talked about earlier, right? And the really important folks that are living, like we're all relatives. Yeah. Mm-hmm. And so that's my very vague answer to your question. It's not, I don't know that it's particular or, defined, but I think it's something I chew with all the time.
I think it's great to know that there is, it's almost a developing kind of thought process definition, or it's constantly something that is evolving. Because we're going to be honest, if we're all related in many ways, then you can also have family members that just stress you out sometimes, right? So it's getting them the support or helping them change their thought process so that they are not the stressful family member. They're the supportive one. But the reason I was curious about the thought process around that is in terms of thinking about what gets transmitted from one generation to the next and intergenerational trauma, what it looks like, how it affects the Native communities. And I am wondering, your take on it. What is that intergenerational trauma? What does it look like? What's passed down? And what's presenting in the communities that you're working with? Liz, if you can start us off on this question.
Sure. I'll just talk about my familial experience, right? My grandmother chose not to speak her language to her children because of fear. So my mom and her siblings don't speak the language, which means I don't speak the language. And that's hard. And that's really, I think, when she was on her deathbed, passing on to just passing away, she really struggled with that. And I think my mom and her sisters and brothers struggle with the fact that they're not connected in that way. But the thing is that there is healing, right? So now my nieces are learning the language. It's coming back to the people. And I think the trauma is not feeling like you're enough on either side, right? So my grandmother chose not to speak her language so that her children would be fully assimilated into, the American society. And they did, and they're successful humans, and they've produced successful humans. But then they don't feel like they're a part of that Native identity because they don't have that language and that cultural structure and background to fall back on and have feelings and connection to the earth through the language, et cetera. And so I think that's a big piece of intergenerational trauma that really impacts identity. And identity is a really big piece of who you are as a human, right? And I think for a lot of Native people across the country, I think that's a similar story and a similar experience. And I think that's why when we talk about like revitalizing language and culture as part of a healing mechanism and a healing and protective factor, it's really important to kind of think about how that trauma has translated throughout the generations from contact to now.
Awesome, thank you. And any thoughts, Leo?
It's a big question. I think, like Liz, I'll kind of just talk about my family. So my father was forced to go to boarding school starting when he was 5. And so that history of, being forced to go to a American school, live away from your family from a young age. And I think a lot of that like pain and loss is like, it passed down to my sisters and I. And just living with that like kind of violence that was done to him and all of these different factors that is just like so I think widespread within the Native community is one example of it. And I think the language piece is so huge. Navajo is my dad's first language, and so he was taught English in school, and that's only like I don't know Navajo that well. I can introduce myself and I can say a few words, but like learning the language is just so huge. And my sisters and I will ask our dad to like send us phrases in Navajo or translations so we can kind of fully learn it for ourselves. And I think that's a piece of it's like we have that experience of having this language kept from us. Like he was forced to learn English and not allowed to speak Navajo, and we haven't learned that. And even within religion, being forced to assimilate to Christianity and not being able to practice traditional religious practices. Those are all things that have happened to our families and that we like are experiencing the effects of just one generation later. So I think that's how it kind of comes through in my life. And that's just so common. Like, I think, boarding school is just so recent, and forced assimilation and forced removal of land is like still going on. And it's just, realizing how recent this colonization is and ongoing that it is. It just really puts it into perspective that we're like getting passed down this trauma and then we're still experiencing it. But at the same time, like trying to learn ways to reconnect, learn your language, learn your culture are just ways to kind of cope, I think, and for us,
Well, I appreciate your thoughts on it. And I'm also just thinking about in the interest of time, I know I'm giving you guys all space to answer questions, but definitely feel free to tell me, I'm not answering that. I'm thinking about intergenerational trauma and traditions and things that have been passed down. And then there is like colonial practices that have kind of been at the forefront of this country, and we're about to experience one in the coming week. And just, experiencing this kind of historical trauma and the impact that it has. I know there are many names that we can give to this upcoming holiday. Is there anything that you want to share about it? And Lael, I'll start with you. Is there any ideas around historical trauma related to this upcoming holiday?
Yeah, I think it's so complex. I grew up celebrating Thanksgiving and grew up, in school having to reenact like Pilgrims and Indians and all of that stuff. And just like really recently in the last few years, learned that Thanksgiving was like a day of Thanksgiving was celebrated after villages were massacred. And I was really upset when I learned that, obviously because I was upset, but also for the fact that I was never taught that growing up, and just kind of, I think there's so many instances of Native culture being withheld, or the violent history of the US being withheld. But for me, not knowing this piece of history and kind of going through the motions of celebrating this holiday my whole life, was just really frustrating that no one, like, there's just, people don't know that this day is like celebrating massacres, of villages, of like families. And yeah, so I think that's a piece, but at the same time, it's so complicated because I know for a lot of families, it's important to gather as a family. Obviously not this year because of COVID, but in general, that is an important piece of like family connection. So I think my biggest just wish is that people knew the real history, and that like Native youth could know that history, because I never knew that and could make the choice to celebrate or not, because it feels just very disgusting to not know that and to kind of grow up and live celebrating it when you just don't know. So yeah, those are my thoughts.
Yeah, I think there's a lot of historical things that need to be brought to the forefront. And I know for a lot of people who are fans of Disney, the story of Pocahontas is not really one that I think most people would be okay with. And so it is teaching that history. It is making sure that the harm that was kind of swept under the rug is actually brought to the forefront. And as a result, I think of, seeing these changes and seeing and hoping and pushing for more change in this country today, we have movements like the Black Lives Matter movements. And there's been a lot of an impetus to make things that were hidden more, visible or brought to the light. And I'm wondering if you can all speak to how movements like BLM has had an impact on Native American communities. And Alicia, I'm sorry, go ahead, Liz.
Yeah, so absolutely. I mean, I think in terms of the erasure of the true history of this country, and Black Lives Matter really kind of bringing the truth out from the Black people's perspective, has really kind of, from an Indigenous perspective, also awoken that true history from our perspective as well. We've been trying to educate. This is not anything new, and it's not anything new for Black Lives Matter either, right? Like, this has been an ongoing struggle since the beginning of this country. And so I think, going back to the Thanksgiving piece, I think it's reframing Thanksgiving and what that means to you as an individual. And for me, it's celebrating, not this year because obviously COVID, but celebrating being with my loved ones and celebrating our family ancestral traditions that were passed down along the generations, and not thinking about the Thanksgiving as a federal United States holiday, but rather a day of family gathering and time and precious energy being shared with your loved ones. But yeah, I think Black Lives Matter has absolutely amplified the Indigenous movement as well. I mean, we stand in solidarity with Black Lives Matter, and we know that solidarity is shared back and forth. We're sisters and brothers in arms, like we have the same struggles. The struggle is there and it's real, and it's the history is there and it's real, and it's acknowledging that and getting other people who are not people of color, who have not experienced that level of repression, to really become allies and understand and acknowledge the true history of this country and what it was formed on.
Thank you. And Alicia, do you want to add thoughts to this topic as well?
Absolutely. I was going to say living in Minneapolis this year has just been so complex, and I think the folks who live in Minneapolis or work in Minneapolis or from Minneapolis, can really echo that, with the murder of George Floyd happening blocks away. And then, our clinic was kind of right on one of the main avenues that was, the third precinct, Minneapolis third precinct that was burned down was the precinct for our clinic, blocks away from my home, right by our clinic, I think with Black Lives Matter, it's really complex. And I think just like we've all been saying time and time again, every single person that's Native is different. And really, from a therapeutic level, I always make space for whatever that person needs, right? And it's really complex as someone. In our fancy therapy world, we talk about countertransference and transference. And while it's really incredible to be a Native person working at a Native org with Native people, a lot of my own identity is always coming up, right? Because so many stories are our stories, right? And so I think, living in a pandemic and going through things in different ways, and then living through the uprising in Minneapolis, there's so much of my own things that were coming up, right? Constantly. And so therapy is really about making space for that person's journey and what they need to work through. So really just acknowledging on an individual level how every person is experiencing it differently. Kind of again about the Thanksgiving thing, this morning I had a diabetes management group. And so we, it's mostly folks that are 65, around the age of 65. And so, I think about our millennials that are just, fighting the Facebook wars and the Twitter wars and how they're just having all of these things about naming and identity. And then I come into our diabetes group, and I like to make space for all types of names for things. So I say, our clinic is closed for the holiday, and that's something to acknowledge, right? And so I always say, for the holiday, I say, if you want to call it Turkey Day, if you want to call it Thanksgiving, if you want to call it Settlers Day, which is a new term that I've heard recently, I said, you get to decide, right? But no matter what it is, our clinic is closed. So I think just making space for folks to experience whatever it is in their own way, right? And that, for so long, there was one way to react, one way to respond as a Native person. And so if I've had folks that are 65 saying, Native folks are killed at higher rates than folks who are Black. I'm angry. I'm angry that we don't have a movement. I'm angry that we're not being seen. I have folks, saying that, they're out on the streets protesting. And so when they don't answer their phone, I'm thinking, are they okay?
Right.
And then I have folks in the middle, saying that, I want to be an ally within the movement for Black Lives Matter, right? Native for Black Lives Matter. So I think just allowing all the experiences, with movements like Black Lives Matter, I think it's a really important space to show allyship within the community, the BIPOC community, right? Because so often we have lateral violence, right? Within our own communities and within it, and that's colonization. And so, therapy isn't the space that we challenge people on their beliefs, unless it's targeted at me as a person. So I always like to make space for maybe what people feel like they are in the minority feeling. But really, I think such a range of responses. And, I think that's what proves that it's a really good movement, that there is a range and that people are paying attention, In Minneapolis specifically, there's been a lot of responses to the uprising. It's caused a lot of challenges in the community because there are direct impacts, right? When there's looting and rioting, we had to have AIM Patrol protecting our clinic so that medicines weren't looted, right? And it's a really complex issue to hold both. This is an important thing to go on, and my pharmacy is closed for 3 days and I can't get the medication I need, right? So I think it's important to just acknowledge the whole movement, and everybody's place in it, and that it brings up trauma response is so connected. And so just making space for people time and time again to breathe. That's, there's so much about breathing this year. There's the I can't breathe. There's COVID with breath. Living in a trauma response all the time is just refocusing on what can you control. So
I appreciate that and sharing your perspective. Thank you. And, I love that you brought in the breath, because I think a lot of times people take it for granted. It's one of the only abilities that you can both control and is also an automatic response. So your body's going to breathe whether you want it to or not, but it is something that we can focus in on. And I'm going to kind of flip my lines of questioning just a little bit, because breathing is really important if you're experiencing microaggressions and when you're seeing cultural, appropriation in places that you would not expect to. And I'm wondering if you can speak to that. What has the impact of cultural appropriation been on Native peoples, and what, I'll pause there and then let you guys respond. Liz, do you want to speak to that question?
Sure. So I think from a Native violence against Native women aspect, I think cultural appropriation has really resulted in the dehumanization and devaluation of Native women. So if you think about costumes for Halloween, the Pocahontas being sex trafficked at 16 years old,
right,
but glorified as a Disney cartoon. That cultural appropriation has been really harmful and damaging to people not seeing Native women as humans. And I think that the way we look at it is we have to recenter what Native women are. We are human. We are here. We are functioning in the society. Sitting right next to you on the bus, we might be, in the clinic next to you, whatever it may be. And I think that when you talk about appropriation from that perspective, it's really one of the main contributing factors to the epidemic of violence against Native women from our perspective in the field of domestic violence. It really, really has negatively impacted the view of who an Indigenous woman is and what her value is.
Mm-hmm. And I think that, definitely identity and supporting the position, value, and importance of Native women is really important, and just in Native communities in general. But I'm wondering how challenging that can be when there are, political microaggressions and explicit aggression against Native American communities. And I'm wondering how you might support the community members in their response to these experiences. And Alicia, if you could speak to that, that would be wonderful.
Yeah, definitely. I think, it's really important to name the microaggressions and the aggressions. I think one thing that I've done, because it's easy when you're not working in the system and you're working out of the system. So much of my work is connection to culture, connection to traditional healing. But sometimes you're in the system. Mm-hmm. And so a lot of two things that I really like to do for folks to really empower them within the microaggressions and aggressions in the system is just talking within medical care. I really like to talk through patients about feedback forms. Mm-hmm. And it's different for every clinic and every hospital, but just letting folks know, like, if this medical professional harmed you, it was 12 years ago, you can still, you're seen, right? Mm-hmm. You have an identity that mattered, that happened. And even though there was a power dynamic, we can do that. I've done that within our own clinic. And I really like to give that way because sometimes you have to use the tools to work within the system. Another example of that is, there's really underreported rates of crime within the Native American community. And that's for a lot of different reasons. We've spoke to some of them before about, further harm that is feared or, not being believed and that type of thing. At our community clinic, one example of this is we've had someone who was a sex worker and was raped. And so in the past, there was a lot of valid fear about, trying to report, not being believed, all these different experiences. And so what ended up happening with that person is they had multiple members of their community, multiple workers and professionals that actually worked with them. We have police advocates in Minneapolis. So there's one for the Native American community, there's one for domestic violence, and a couple others that are intentionally there to be an advocate and support for you throughout the process. Mm-hmm. So we had that person and a couple other folks, and the person ended up reporting at our clinic, right? And so I think sometimes with these aggressions and these microaggressions, again, it's that learned helplessness that nobody's going to care, nobody's going to listen. My life doesn't matter, right? That hopelessness, that helplessness. And so building in ways and saying, I believe you and that's the truth and it's wrong. And these are the ways that we can balance that power dynamic. If a medical professional harmed you, we need to report it and we need to talk through it. If, you had a crime against you, I understand why you don't want to report and that's your choice. And here's what you're doing, right? And I just remember this memory of this person who was reporting they had 3 different Native women with them that were professional workers with the police reporter at our community clinic. And I was just thinking how much work it takes to support someone in a system that's supposed to be protecting them in the first place, right?
Right.
So, yeah.
I mean, it's a really powerful example. And it's a model that I think we need in many places, especially when it comes to our most vulnerable folks in the most vulnerable position, to basically to name the aggressor and say, this is what you did. You need that support. So it definitely makes a significant impact. It helps to help the person feel held in order to follow through, because without it, this person can go on doing the same thing, right? And that, I think, that becomes another issue that the person starts to hold, like, I should have said something, or if I didn't say this, or, you know, so there's a lot of complexity again with all of these different topics. I think one of the things that you brought up was, you know, this person is making a complaint or filing, you know, a complaint against someone who did something within your organization. But I'm wondering, what happens when Native American folks are outside of their community, and what happens when they don't have that support, and what are some common issues that you all might notice in terms of how what are they met with? What are the struggles that they face when they're outside of their community and they're searching for services?
That's such a great question, and it's one we think about all the time. Even in our own communities, there are cracks that we fall through, right? Those cracks get even bigger in an urban setting or a setting where natives aren't so prevalent. And I think in terms of being able to access services that are culturally appropriate, are even designed to be responsive to somebody who's different than, you know, the quote unquote normal patient or normal client, whatever that may look like, is really important. And gosh, where was I going with this? I had something.
It's late. Understandable. Take your time.
I think that it's one of the reasons why Stronghearts Native Helpline exists. Okay, so it's one of those, you know, one of the main reasons is that we know there are so many gaps, and to have the ability to pick up the phone and call somebody who understands where you come from, what you might be feeling, you know, what your identity situation is wherever you might be, and be able to refer you to someone who's going to understand you, or be able to just be there to listen and be that ear on the other side of the phone, I think is really important. In terms of, you know, other services and access to services, I think it's one of those things that we're going to continue to struggle with. Unfortunately, there's just so many gaps to be filled. And, you know, our hope and my ultimate dream is that we'd be able to have those kind of systems put in place every single place across the country, across the world, even, or that people out in the system would recognize that the system is a system and that systems aren't necessarily always a good thing, right? And to be able to recognize a patient for who they are and what they're dealing with, and be able to assist them through whatever that situation may be in a way that is you know, calming and healthy and meaningful. But until we get to a point where we are restructuring the way our medical practitioners, our educators, our legislators, the way we even learn in school, until we restructure all of that, it feels like the gaps are just going to continue to exist. And it's something that it's a very structural issue at this point, structural and foundational.
Yeah.
Sorry.
I mean, it's honest, and it's, you know, thinking about, like, what can we do as a clinician myself, and as someone who has Native blood, and as someone who's Black identified, like, there are things that, you know, you want to be empowered to do, but you also don't want to send in people who are ill-educated or who are ignorant in many ways to rush in and do more harm. So I'm wondering, are there things that for those who are interested in supporting the Native communities, are there things that you would suggest that they do first in order to be a support?
Yeah, educate yourself. Read up on the actual history of the United States. Engage in conversation with natives, and don't be afraid to ask questions, but don't be afraid to be told that you're wrong for something too, right? And accept that you might be wrong, and that's okay. And ask those hard questions, because without asking those hard questions, you're never going to understand the true complexity of what the Native identity is. And you're not gonna understand it anyways, because we're all so different, right? And that's okay. And I don't understand your identity as whoever you may be either. But just taking the time and the energy to at least try to understand goes a long way, and will really improve your performance as a practitioner, as just a human being overall, generally, right? Like, we should all try to be understanding and compassionate, period.
No boxes. And I'm also just kind of thinking about, everything that you have shared and the importance of resilience, the importance of, being strong and remaining, present. I think one thing that a lot of people who have not had an oppressed particular perspective have a hard time understanding is, how did you survive? How did you stay strong? What made you so resilient? And I'm wondering if you could speak to what keeps the Native populations, resilient, what keeps them strong and allows them to continue to forge ahead. And I'm going to open that one up to anyone. Lael, do you want to start?
I can try. I haven't spoken, but it's so hard. I think, there's so many pieces, but it's hard to think about. I'll try to answer it from my perspective. I think a lot of it is like stories from like family and ancestors, and knowing, like hearing stories from my parents and grandparents about like struggles and oppression that my ancestors have faced, but then knowing that they pushed through that and they were strong. I think for like Navajo society, we are matriarchal. And so hearing about like Navajo women and my grandmothers and aunties and just seeing how powerful they are, that's always a reminder that, whatever I'm facing, like I can push through it, or I have these people who are protecting me and looking out for me, and who have come before and done this. And then I also think for me within my life, just having, being raised to really value family and value community. I don't think that doesn't necessarily have to be like a uniquely Native American thing, but I think that's really important for our tribes and for Indigenous identity, is to value that community and family structure. And so that's something like I can lean on and really appreciate. But yeah, I think it's kind of amazing to look at this history, the history of the United States and the history that we've been through, and know that we're still here, and know that we're still alive. We're still pushing for the health of our people and for, the happiness and well-being. So that's really inspiring, just to know how long we have survived. So
yeah.
For me,
Alicia.
Oh, sorry.
I'm sorry. Go ahead.
Sorry, I keep doing that. For me, it's really talking about the generations of the past and then moving forward to the generations of the future, right? Our ancestors paved the path for us, and now we're paving the path for our ancestors, or for the future generations. And I think it's really important to recognize the struggle and the resilience of the people who came before us, and that their struggle and their resilience was on a different level at a different time, and ours is at a different level on a different time, and that our future generations are going to have struggle, but hopefully with our struggle comes less struggle for them, right? And that's kind of what keeps me motivated, trying to make a better human race, a better planet, a better place for my nieces to grow up into, and then for their children to grow up in. And so I think that's what keeps me motivated. And every once in a while it gets frustrating, but you take a deep breath, take a day off, relax, use your sacred medicines and return to battle the next day, right? And so I think that's kind of what keeps me going. It's also pride. I take pride in who I am, where I come from, and the strength of my family. So I think having those things combined is really what keeps me motivated to keep the fight going.
Awesome. Thank you.
Liz and Lael have spoke to so much. I'm not sure what to add. I think the only thing I can think is humor. That has not been talked about yet. I cannot talk about how important it is to just have humor. You know, and most of my coworkers are Native as well. And so our staff meetings, you know, I actually had someone join our team recently that said, this is my favorite meeting because I can't tell you how many times we are just cracking up and we're laughing in tears, and we deal with some really serious, really heavy things. And time again, you know, even things like therapy memes and things with each other and with our community, you know, permission to have joy always, you know, I think sometimes is just such an important factor. And yeah, just humor in its own. I had a patient tell me one time, you know, they're trying to transfer before they met me to where they were living. But we live in Zoom world. And so they said, you know, the reason I don't want to transfer anymore is because you make me laugh every single time. And so I say, you know, it's not always appropriate to laugh in therapy, you know, at different times, but there's always something to laugh about. And I think just joy from so many things, our connection to ourselves, our connections, you know, past and future, to our relatives, you know, thanking the spirits that are always around us. You know, every morning for our staff meeting, you know, say a prayer to the spirit of COVID and ask for it to have mercy on us. You know, I think having those moments of connection and those moments of humor and joy is always what will propel us through, and it's its own protection, you know.
Lovely. Thank you. I'm going to ask, is there anything else that you feel that you guys wanted to share or want our viewership to take away from our discussion? Because there's been so many great points. I want to make sure that I didn't move too quickly over something, or there was an idea that was like, I wanted to. Is there anything else that you would want our viewership to take away?
I think I have just two terms that I've been chewing on, trying to wait to find the right moment to put them in. And I'm sure folks already in our community know about CPTSD, which is kind of a talk about complex PTSD. And something that I just kind of want to leave folks with is just the idea of social disability. And so it's kind of what's moved from a disability model in the past that was moral or medical, and moved towards saying that, you know, the reason folks have disability is not because of something wrong internally, but because society doesn't have a place for them to fit. And I think that's really applicable within the mental health field when we're talking about PTSD. It's such a common diagnosis among the folks that I see time and time again. It doesn't fit most people that I know. Complex PTSD also doesn't fit, which isn't in the DSM. And so thinking about things through as you're working with folks in the Native population, this social model of disability, in that it's not, and you kind of said this earlier when you were going through the question, you know, it's not PTSD because it's a really appropriate response to harm. And so instead of it thinking of things as PTSD and that the person is having, you know, an adverse response or something that should be managed, really naming that it's a social model of disability. And it's the fact that we should be putting emphasis when we think about this perfect world on the harms that are done and not the person who's harmed. And that's just one thing I always bring with me when I talk through folks and give diagnosis of PTSD, because there's often a very personal component of it that people think, well, what did I do wrong? Or I'm overwhelmed and I have to fix my trauma. So I always like to include this concept of social disability, and hopes that at some point, maybe we're not diagnosing folks and pathologizing harm, but we're actually focusing on the folks who are harming in the first place. So just something that I was thinking about throughout our presentation.
I
love
that. And I would say, I was just going to say, definitely check the chat too. And that should be in there, and hopefully we will see lots more articles and discussions about social disability come up. And go for it, Liz.
Oh, I was just going to say thank you for bringing that up. Opening up my mind in a way that I haven't thought about before is really important and really exciting. So now I'm going to go to bed and think about all of these kinds of things. So thank you for enlightening me tonight. But really, just thank you for hosting this important conversation. I urge folks to visit our website, NIWRC.org, and StrongheartsNativeHelpline.org for more information about the impact of colonization, of white supremacy, of just societal issues on Native women and the impact of domestic violence and sexual violence. We have a lot of materials, and I'm happy to answer any questions that anybody may have via email. My email is ecarr@niwrc.org. So just wanted to put that out there in terms of contact information. Thank you very much.
Thank you.
Yeah, I think I just want to say thank you for organizing this, for having me. Don't really have any but a lot to think about, and I think I'm feeling more inspired and just to kind of keep doing this work, because I think it does get tiring, but to know that there are other amazing people doing this too is really good to know. So yeah, just thank you for holding this for us.
Well, I want to say a huge thank you to all of you for participating. This has been such an amazing conversation. And again, thank you TogetherWell for hosting it. I know that there's been lots of different topics and lots of different things that have been shared. And I think one thread that I'm weaving through our conversation is about the importance of connection and being together, and that we're all related in one way, shape, form, or another, and to support each other. And so I thank you all for participating in this discussion and supporting other clinicians who are wanting to go out and do good, but to also make sure that they are informed first, because we don't want to create harm in our efforts. We know the road to hell is paved with good intentions, so we need to make sure that we take our time and be present and supportive and informed in making our decisions. So thank you again so much to each of you for participating. And with that, we will end for tonight. And for all of our viewers, thank you. We are wrapping up tonight. If you are interested, we will be doing the meditation and the Pilates offered by, well, the meditation is this evening, which is offered by the PAD. Again, I want to make sure that I recap on all of the things I shared before. But first, I just want to again say thank you to all of our speakers, and thank you to everyone who attended this evening. We really do appreciate you for joining us after such a long day. Also, if you would like access or information about any of the resources that were shared, please check out our resource guide. You can also check out the information that is in the chat, and you can also go to the TogetherWell website to get any more information. Our video will be up on YouTube shortly, so you can check that out after the event if you're interested in having the recordings or want to share the video with other folks that may not have been able to take a watch. Also, I wanted to remind everyone who is interested in using ATABS for their studying, definitely take a look at their site. You get 15% off of the Human Diversity course. And this is offered with the CE. Use code TW15 if you're interested in doing that. And also, if you're interested in offering workshops or doing work for the community, you can join TogetherWell. It's an amazing platform where you can create your own profile and share the work that you're doing with others. So definitely go to the website to learn more. Last minute updates, if you are interested, we are going to have a couple of events. One where there's going to be an all-day event for our graduate students and early career therapists. You can hop in and out of whatever parts you feel would be best for you. It's completely free, but please check the site or RSVP using the link that was provided in the chat. Also, if you are going to stay, make sure you join the meditation, or you can also stay for an additional hour to do networking and connect with any of the folks who were here this evening. Remember, the theme from this evening's chat is about connection and support. So definitely connect with each other and start discussions, and definitely have that support in your back pocket. Without further ado, I will say my good night and thank you again for joining us, and hope to see you again at another TogetherWell event. Take care.